Good morning, Dr. Ferguson coming to you from the Passioncam. It's almost Christmas, a very exciting time of the year for me and many of you. And remember that Jesus is the reason for the season, but as we approach that season, it's important. I'm going to talk a little about Alzheimer's today. It's important that you don't bombard your loved ones with gifts and peoples and change in atmosphere. All of those things will be negatives. The person with Alzheimer's disease, or usually dementia of any type, for the most part, they don't like a lot of change. They don't like a lot of different things in their life. So already you're going to have some different things going on in your house, because you're going to have a Christmas tree probably, and you're going to have decorations, and you're going to have a lot of people maybe coming in and out. So it's important that you try to minimize the amount of change for your Alzheimer's patient. To minimize don't rearrange the furniture as little as possible. Don't go in and just do a whole revamping of the furniture. As loved ones are coming in and greeting that patient with Alzheimer's disease that maybe haven't seen them in a long time, don't let them get into a quiz contest. And what's my, oh, you know my name. Yeah, I'm Brother John's son. Come on, you know my name. Don't do that. That's a negative. If their Alzheimer's disease is at a point where they still recognize that they don't know things, that only makes it more of a burden for them, for you to keep identifying to them what they don't know. So don't do that. Don't get into the naming issues with them, and try to flow with them. If they call you Mary, be Mary. If they call you John, be John, and just kind of carry on the conversation with them. The Alzheimer's patient's long-term memory stays on better than the short-term memory. So that's one of the characteristics of Alzheimer's disease, is they lose short-term memory first. So you may be able to talk to them about things that happened in the distant past, and they seemingly give you a reasonable conversation. But then when you talk about stuff in the immediate past, they may seem more confused. And that's just kind of a guide for you, just to try to keep your conversation, if you're going to try to conversate. A distant conversation is probably going to be better than a more recent, because they don't remember that very well. And again, try not to be confrontational. Try to make them remember things that they may have forgotten. If they know, great. If they don't know, that's fine too. Put the quizzes out. How many kids do you have? Well, you have 5 kids. Well, no, you only have 4 kids. Well, no, don't get into that back and forth with them of mistakes they may make, but just flow with them. A little tip there for Alzheimer's disease, dementia. Many dementias are going to function that same way, but as we move into this Christmas season and holiday season, more people around, try to keep that Alzheimer's patient's environment as controlled as possible. When you go to a lot of different people's houses and things like that, that also can cause a problem, because it's a new atmosphere. They may not know where the bathroom is, so they may go to the bathroom all themselves. They may go to the kitchen to go to the bathroom. So they may do all kind of things that aren't correct, and then it's embarrassing for them if they still recognize that they may be making some of these errors. So a very controlled environment is going to be the best one. On that note, be blessed and have a wonderful Merry Christmas and Happy New Year. And remember that Jesus is the reason for the season. Be blessed. Bye-bye.